How effective is non-hormonal birth control? For those seeking alternatives to hormonal birth control methods, non-hormonal options offer various benefits, including fewer side effects and natural family planning. However, it's important to understand the effectiveness of each method to make an informed choice. I'm going to give you an overview of non-hormonal birth control options, along with their statistical efficacy, to help guide your decision. Barrier methods. Male condoms. With perfect use, male condoms are 98% effective. However, with typical use, the effectiveness drops to about 85%. They are also beneficial in protecting against sexually transmitted infections, STIs. Female condoms. These have a perfect use efficacy of 95% and typical use efficacy of around 79%. They also provide protection against STIs. Diaphragm with spermicide. When used correctly and consistently, diaphragms are about 94% effective. With typical use, their effectiveness is around 88%. Cervical cap with spermicide. For women who have never given birth, the cervical cap is about 91% effective with perfect use and 86% with typical use. For women who have given birth, the efficacy drops to 74–76%. Intrauterine devices, IUDs. Copper IUD, Paragard. The Copper IUD is one of the most effective forms of non-hormonal birth control, with over 99% efficacy. It can remain in place for up to 10 years and can also be used as emergency contraception if inserted within 5 days after unprotected sex. Natural methods. Fertility awareness methods, FAMs. These methods vary in effectiveness depending on the technique used and the user's diligence. Typically, they are about 76–88% effective. This category includes methods like the calendar rhythm method, basal body temperature, and cervical mucus method. Withdrawal method, pull-out method. This method has a perfect use effectiveness of about 78%, but requires considerable self-control and experience to be effective. Sterilization, tubal ligation. This surgical procedure for women is over 99% effective and is permanent. Vasectomy. A vasectomy for men is also over 99% effective and considered a permanent form of birth control. Other considerations. It's crucial to note that except for male and female condoms, these methods do not offer protection against STIs. For those at risk of STIs, using condoms in conjunction with these methods is advisable. The effectiveness of each method can also vary based on individual usage and consistency. Non-hormonal birth control methods provide a range of options for those looking for alternatives to hormonal contraception. From barrier methods to natural family planning and sterilization, each method offers varying degrees of effectiveness. Understanding these statistics and how each method aligns with your lifestyle and family planning goals is key to making the best choice for your reproductive health. As always, it's recommended to consult with a healthcare provider to discuss the most suitable option for your individual needs.